The strengths of the course, I think, are that it's not only a theoretical, or they're not only theoretical papers that we provide, but also we help students to actually apply it to their clinical setting. I've actually got two roles at AUT. One of them is as postgraduate head, so I end up working with the child health program in an advisory role for potential students who want to take a child health pathway. And then I also teach a clinical assessment paper, and we teach that as a specific child health paper within the child health program.
Sarah MEEHAN is one of the students in the child health program. She also works as a nurse in Starship's paediatric intensive care unit.
We're doing a clinical assessment paper, so we do one day of study about every 3 or 4 weeks, and then we also do hands-on practice in the wards in Starship.
You take the carotid while you're listening.
We're taught a lot of really good assessment techniques on this course, and then we get the hands-on practice to try them out and get experience before we actually go into the clinical setting and work with patients. So yeah, and we get support all the way through.
Okay, come on Julie, let's take now that learning you've had in the classroom and you can do an assessment for me.
I'm the program leader for the Postgraduate Child Health program, so I oversee the running of all the programs. I liaise with the different paper coordinators. I talk to clinicians about the program and about how we could be helping them. I give academic counselling to staff. I also teach 2 of the papers within the program.
Julie BLAMIRES is a nurse specialist in paediatric rheumatology. She is also studying in the child health program at AUT.
Now you know what I'm going to get you to do? I'm going to get you to give me your hands, because I'm just going to examine each one of his joints, just to feel and watch for him if there's any pain.
All our students work in clinical practice. That's a requirement of the course, and so they then have to go out and apply the knowledge that they've learnt and then reflect that in the assessments we do.
Well, basically you're given the theory in the class, and then you're given the opportunity to practice it in the hospital setting. I'm lucky in my job because I do see patients in clinic, so I'm given lots of opportunity to practice my skills. And one more. Very good.
MICHAL Noonan is a lecturer at AUT in the child health program, but also works as a health practitioner at a clinic in TINEKE.
I work in a clinic in primary care, and it's a nurse-led clinic where I see children and young people who come in on the days that I'm there, and I see them, treat them, diagnose them and send them home.
Can I ask you to turn around and listen to your
My work at TINEKE is great because when I go back to AUT I've got real life situations to discuss with students, and I think that makes it really useful. And also for many of our postgraduate students, they're on the pathway for nurse practitioner, and I'm at the end of that pathway, so they actually can see someone who's kind of been along that journey, and I think that's really powerful as well. And also just because I am in clinical practice, I often will have students come with me and spend time with me in my clinics, or doing home visits for children in the community. So I think being able to combine the clinical work and academic work has a real advantage for students.
The child health program offered by AUT has partnerships with several child health clinics and is therefore able to offer its students a chance to develop and extend their clinical practice.
In terms of a partnership, we're running the paper, but for the practice sessions, there are probably, depending on the number of students, there's one clinical nurse educator usually to about every 2 or 3 students. So that's one partnership, and that works at both Auckland District Health Board and at Counties Manukau with Kids First. So they both are involved there doing that, assisting with the practice.
TINEKE is also a lecturer at AUT teaching on the child health pathway.
I lead one of the papers, the Children in Context paper, but I also teach on the other papers as well. The online component really suits students because a lot of students in health obviously work shift work and work different hours, so it allows that flexibility that they can come on at 2 o'clock in the morning if they like.
Obviously working part-time, and there's lots of people who are working full-time and studying part-time. It's just not possible to take time off work and take time off from your family to come and attend classes.
Healthcare delivery around a child is never just one discipline. It's always a mixture of people that are working together to optimise health outcomes for that child. So I think having educational programs that support interdisciplinary, multidisciplinary perspective is really useful.
The idea is that all disciplines that work with children can come together and work towards making sure that their practice with each other and with families and children is actually quite cohesive.
One of the great things about the AUT Child Health Program is that you know, as teachers, we've also worked clinically with undergraduate students and postgraduate students, but we also have a passion for child health.
And AUT in particular, I just have always had great support from the lecturers and a lot of resources available to us.
The teachers that are here are really experienced paediatric nurses who have, you know, most of them gone on to do masters and PhDs.
And the Child Health Program has quite a wide reach, and we've had students from not just Auckland but throughout the country.
I think that anybody who does postgraduate study ends up growing as a practitioner, that they become much more of a leader.
They not only advance themselves personally but also professionally, and at the end of the day their best outcomes are reached for the children of which they're caring for.